Okay, thank you, Hindi team. Now we are moving to English session. Today is our 1456th day of continuous webinar. Thank you all the participants, faculties for your knowledge sharing, and thank you all the participants. You are inspiring us to continue this program, and thank you all the back team supports for still you are continuing with us, and many homeopathic lovers are with us. Thank you all, and now we'll start with a silent prayer.
Okay then, thank you so much. I'm leaving now. Thank you. Yeah. Okay, bye-bye.
Welcome once again. Today's our guest is Professor A.K. Gupta MD in homeopathy, and he's a homeopathic consultant and gold medalist, founder and director of AKG and OM Vidya Institute of Homeopathy and Allied Medical Science, accredited in Limca Book Records, and pioneer of integration of healthcare, National Secretary General of Homeopathic Medical Association of India, and former visiting professor of Sir Homeopathic Medical College Hospital, Delhi, and ex-guest professor of Homeopathy College, UK, and guest physician of Glasgow Homeopathic Hospital, UK, and he's practicing since 1977. Former nominating member of Homeopathic Advisory Committee and Delhi Board of Homeopathic System of Medicine, doing research work in cases of motor neuron diseases. And he's an author, he's an award winner. He delivered many speeches nationally and internationally, and he conducted many webinars internationally and nationally. He delivered talks in the on air and in Doordarshan. So we are today we got an eminent personality for taking our class. You're welcome, sir. Gupta sir, you're welcome. Wait, sir, I'll make you a session host. Okay, you're welcome to IFPH forum. Now you can share your slides. Okay, unmute yourself.
Yeah.
Thank you, sir. Thank you for coming.
Thank you. Good morning, good afternoon, good evening, and first of all, very, very happy Janmashtami to all. Today being Lord Krishna's birth. So we...
Oh, really? Today is...
Yeah. So first of all, Jai Krishna to everyone. And Krishna's theory is the karma theory, what Krishna has told us. So to start with, first of all, I would like to thank IFPH and Consulate for the 1456th episode of continuous webinar, which is a historical event. And any webinars to be continuing and having an education imparting all over the world about the homeopathy to the students and to the lovers and to the, even the practitioners also of homeopathy. And today I would like to, can I share my screen?
Sure, sir. You can share.
Is it visible?
Sir. Clear. Yeah. Anorectal disease, homeopathic
treatment. Anorectal disease and homeopathic treatment. So welcome to this particular class for anorectal disease and homeopathy. As we all know, first of all, we would like to welcome and pay homage to our Dr. Henneman and say that homeopathy ensures health safely. Now, this is what we say anorectal diseases are a group of medical disorders that occur at the junction of the anal canal and the rectum, including constipation, diarrhea, hemorrhoids, abscesses, fistula, fissures, anal itching, warts, pyrenoidal sinus, and rectal prolapse. In our homeopathic practice, we see quite a good number of cases which come into this category. So more pronouncedly, we see the patients of hemorrhoids and constipation, which is a very, very common problem. And constipation is one problem where we say that it is because of the lifestyle, because of your eating habits, because of your, living lifestyle, and the kind of a food you take. Other things also, which includes the intake of water and the total consumption of water and other intoxicants like tea, coffee, or alcohol. They do add into this, problems of constipation. And if a person has been having a job of continuous sitting for, sedentary job, sitting for a very, very long time, he also is likely to, have this kind of a problem. The common anorectal symptoms are anorectal bleeding, pain and discomfort, perianal itching and irritation, something coming down, and perineal discharge. These are the common symptoms which we see in the patient who is suffering from anorectal disorders. These can be rectal prolapse, anal incontinence, hemorrhoids, pruritus ani, anorectal abscess, anal fissure, anal fistula, anorectal polyp, and malignant and neoplasm. So there can be types. There are anal and perianal. In anal category, we have got hemorrhoids or piles, fissure in ano, fistula in ano, anal abscess, and anal cancer. And perianal, you've got a perianal abscess, pruritus ani, and anal warts. Hemorrhoids, or commonly known as bawasir in Hindi speaking people. As you can see, this hemorrhoids, also called piles, are swollen veins in the anus and lower rectum. Hemorrhoids are similar to varicose veins. Hemorrhoids can develop inside the rectum, called internal hemorrhoids. They also can develop under the skin around the anus, called external hemorrhoids. Hemorrhoids or piles may be internal or external according to the whether they are internal or external to anal orifice. Some common homeopathic medicines which we come across, which we see, and which we need to understand while treating the patients. I'm sure that everybody who's treating the patient with hemorrhoids, they are very well aware of these medicines. For internal piles, we have got Aesculus, aloes, arsenic album, bromium, chamomilla, colocynth, hemamelis, nux vomica, podophyllum, pulsatilla, and sulfur. Whereas for external piles, again, Aesculus, aloes, hemamelis, lachesis, muriatic acid, retania, and sulfur. These are the common remedies which we found to be useful in our practice. Now you can see the case of a patient who had a hemorrhoids. This is a case of AAC 1566. In the initial picture, you could see these, piles were prolapsed completely in external piles. So almost a third-degree pile. And after the treatment, the patient has become much better and normal. The piles have gone and there's no pain. In this case, the patient was in such a agonizing pain was there that he could not sit, he could not stand, and he could not walk. So this was the situation. And after the homeopathic treatment, he became all right. Prior to coming to homeopathy, he had tried many medication, local application of, what you call Hedensa and all that, Pilex, which is, readily available in the, market. or had gone to some Ayurvedic and allopathic doctors also, who had once given him the injection, and he became all right for some period of time. And after giving the injection, say around 6 months or so, the pain, the piles reappeared. Types of hemorrhoids, internal, we call it as degrees also. It's a first degree, second degree, or third degree pile. Internal hemorrhoids lie inside the rectum, usually can't see or feel them, and they cause discomfort, but straining or irritation when passing stool can cause bleeding during bowel movements. A hemorrhoid to push through the anal opening called a prolapse or protruding hemorrhoid. This may result in pain and irritation. Whereas the external pile hemorrhoids, these are under the skin, under the anus. Symptoms might include itching or irritation in the anal region, pain or discomfort, and swelling around the anus. So as I was telling about the degree, this is a first degree pile where just prominent vessels, no prolapse, and just prominent vessels. Second degree piles is prolapse. The pile comes out with strain, but spontaneously reduces and it goes back. Third degree piles prolapse with strain and have to be pushed back in. When you do pressure, try to put it, it goes in. So this is a third degree pile. And fourth degree pile is a prolapse out, and this cannot be pushed back. There's a permanent, they remain out and prolapse. Feeling is there. Now, coming to the causes of prolapse, piles. First is the pregnancy, which is, can be considered a physiological. During pregnancy, the increasing weight of the developing fetus and uterus put pressure on the pelvis. Aging, hemorrhoids are most common among adults age ranging from 45 to 65 years of age. However, young people and children can also get them. Nowadays, I have seen in my practice, age has remained no more than criteria for any kind of a disease. Like, as we say, the piles were of 45, now we have the patient, young patient at the age of 15, 20, they do suffer from piles. Like you see the patients who have, cataract at the younger age also, whereas it used to be considered as a older age problem. Diarrhea, hemorrhoids can occur after cases of chronic diarrhea. When they keep on having recurrent diarrhea, you need to clean that particular rectal part, and with the irritation and all that, one may develop piles also. Chronic constipation, straining to move a stool puts additional pressure on the walls of the blood vessels, which may result in hemorrhoids. Sitting for too long, spending a long time in a seated position, especially on the toilet, can cause hemorrhoids. And we have seen people, traveling long distances, and driving the car or, Jeep or something, they also tend to get that. Diet. Eating low fiber foods may contribute to hemorrhoids, and especially people, those who go for a more of a non-vegetarian diet, they also tend to get, piles, because fiber is reduced, it's lesser, so they tend to get, this hemorrhoids. Heavy lifting, repeatedly lifting heavy objects can lead to hemorrhoids, and anal intercourse. This can cause new hemorrhoids or worsen the existing ones. This is what we call like, some people have the tendency or liking for going in for anal intercourse. So they also tend to develop hemorrhoids. Weight, overweight to a higher risk of hemorrhoids. This may result from increased pressure with the abdomen. That these are the constipation, hereditary, obesity, pregnancy, weightlifting, and sedentary lifestyle. Now, we understand what are the causes and what are the symptoms. Now, we must tell the patient, I mean, apart from giving him the treatment of the medication to treat and cure, we must tell the patient how one can prevent. The do's and don'ts are very important. Do's are stay hydrated and consume fiber-rich food for softer stool, perform warm water sitz bath and cold compresses, avoid alcohol and caffeine to prevent constipation, and do regular exercises. Don't do not strain for the stool. Avoid long time sitting position. Do not sit in toilet for a long time. Do not wipe harshly after bowel movements, especially going to the toilet with the mobile phone and all that is a bad habit which may tend to cause more constipation and causing more problem of hemorrhoids too. Coming to the another next problem is anal fissure, which tears or split in the anoderm just distal to the dentate line, occurs at any age, but usually seen in younger and middle-aged adults. We have seen nowadays, I mean, in my clinic, the young children also, I mean, about at the age of 1 or 2 or 3-year-old, or even the toddler, those who get constipation, those who are, I mean, not breastfed, they are artificially fed, and less intake of, I mean, milk or these kind of a thing can lead to constipation. And if the mother or the father have got a tendency, especially the mother, the child also suffers from constipation. And constipation, very hard stool, leads to the fissure. If the mother takes a very strong food, like, I mean, whatever we discussed in earlier, as for the constipation do's and don'ts, but if the mother who's been lactating and feeding the child, if she gets constipated, she has a problem. We have seen the child also develop this same kind of a problem and suffer from anal fissure. You can see that there's a bleeding in the stool, or there's a cut around the anal region. The posterior middle fissure common in both sexes, but anterior middle commonly affect women. Fissure in lateral position, it occurs in Crohn's disease, TB, syphilis, HIV/AIDS, and cancer. And also due to long-standing loose stool can also lead into anal fissure. Anal fissure, if it is a longitudinal tear in the mucosa and skin of the anal canal, commonly posterior midline, more commonly in female than male. And some common homeopathic medicines which we have found to be very, very useful are chamomilla, glyphides, lachesis, nitric acid, retania, sepia, and thuja. Causes of anal fissure can be local trauma, usually by hard stool to the anoderm, overstretching and tearing of the squamous epithelium of anal canal, reflex sphincter spasm, recurrent episodes of diarrhea, and cleaning with toilet paper. This, like, I mean, there was a time when people used to use hand wash, do it washing with the proper hand and water. But nowadays, with the modern society, they've started using toilet paper. So when they use the toilet paper, sometimes the papers are little harsh and hard. So they also add into this possibility of developing tears and injury to the very soft and delicate part of the body, which is rectum and anal area, and that can also lead into anal fissure. And anal infection, of course, can be one of the causes which can lead into anal fissure. Signs and symptoms of anal fissure, there would be a pain, sharp cutting, very sharp cutting, tearing, pain, which starts with a defecation and persists till several hours after. The patient complains the moment they try to start passing stool, the pain starts, and the pain, along with the burning, stays for hours together. bleeding. In this bleeding, you normally have streaks of blood, red blood along the stool. Whereas we have used to have in hemorrhoids, we had a bleeding, but in the hemorrhoids and the piles, the bleeding would come in drops, or like a, fountain kind of a wood thing would be there when it bursts, or there's a capillary burst that would be leading into this droplets or drops. Whereas usually in this anal fissure, the stool is, smeared with the blood, streak blood, because with the passage of stool, the wherever there is a, what you call tear, or it does, it passes the stool, so it keeps the gives a line streaks of blood which comes along with the stool. Discharge and itching. Swellage of underclothes, increased moisture of perianal skin with pruritus around the anus. Lower end of the fissure can be seen, and sentinel tag or pile can also be present in some cases. Now you can see in this case, before when she came to me, that this was the problem of anal fissure. You could see that complete tear is so long, and with the bleeder mark over here. So whenever the stool would pass, it touches to this area and gives a blood along streak to the stool. And after the treatment, the patient has become all right. There is no tear, there is no kind of a bleeding, and no pain. And the very, very important thing, which the patient does not know, and he complains that I have got a, if they have not heard about the anal fissure, because piles is a very common thing and everybody knows about it. So they think that they have got a piles, and because of the piles, they got a bleeding. But how to differentiate between the pile and a, bleeding and a anal fissure bleeding, that I told you in the beginning itself, like the streak of blood would be there with the stool, whereas in the piles or hemorrhoids, there would be blood droplets or drops of blood, or a fawara like kind of a thing. And in piles, it may be painless. There couldn't be a bleeding painless. But in fissure, it is always associated with the pain and very tearing and sharp pain. So these are the two things which we can very easily, whenever the patient is comes to us and tells the problem, and we inquiring about these two things, we can very easily diagnose without even going in for a proper examination. Though we do need to, examine, but sometimes patients are hesitant to, get the examination done. Then only with the symptoms we can make it out whether the patient is suffering from a hemorrhoid or suffering from anal fissure. Now, next, coming to the fistula in ano, it is abnormal communication between any two epithelial lines surfaces. Pipe-like structure, it is tract lined by granulation tissue which connects deeply in the anal canal or rectum and superficially on the skin around the anus. In this fistula, also, sometimes mimic the patient does not know, patient just says that he's got a bleeding or he's got some kind of a discharge. And we do not know the exact situation of problem. After taking a complete case history and inquiring about the details and seeing the patient with the proper examination, we can make it out whether the patient is suffering of fistula in ano, or it's a fissure, or it's a pile. It is a tract lined by granulation tissue which connects deeply in the anal canal or rectum and superficially on the skin around the anus. It usually results from an anorectal abscess. There have been cases when the patient usually used to have some abscess, and after the abscess has healed and all that, something has been left, and which can develop into anal fistula. And the very common remedies which I have found to be very useful in my practice are Aurum met, berberis, Calcarea fos, carbovage, carcinosin, causticum, hydrastis, calicinatum, nitric acid, and silicea. Now, in this case, you can see that my patient has fistula, piles, and problem had been there with a kind of a discharge, with a pain earlier. Sometimes there would be a pain initially, and after the discharge has been passed out, the pain would subside. The patient would be happy. Now there's no pain, no problem. So sometimes they stop the treatment in between. When there's no pain, they think they're all right. But after few days, again, fistula occurs and starts discharging and causing pain whenever there is an accumulation of pus, whenever there is an accumulation of fluid along with this, blood, there would be a pain, discharge. It can be offensive, it can be purulent, it could be very thick also. So we need to see, and accordingly, when we see these things, we need to select our remedies also accordingly. And this was the patient before the treatment, and this is the patient after the treatment. Cause of fistula in ANO. Is faulty bowel habits, straining during defecation, improper sitting habits, excessive riding, sequelae of anorectal abscess, chronic fissure in ano, trauma, injury at anus, anal carcinoma, pyelonephral sinus, Crohn's disease, ulcerative colitis, and actinomycosis. These can be the causes for developing fistula in ano. And coming to the sign and symptoms, single or multiple external openings could be there, persistent mucopurulent discharge, pus or blood mixed discharge, cutting, throbbing, pricking pain, soreness and itching of perianal skin. Now, in this case of fistula, as I told you that, there's some investigation, we must carry out because of the nature of problem. The common investigation we would like to get that done is blood, because sometimes there have been patients who have been bleeding for quite some time with that per rectum because of fistula or fissure, and they are not aware of that they've lost, how much blood they have lost, and sometimes they are found to be quite anemic also. So it is always advisable to get the HB, TLC, DLC, ESR, bleeding time, clotting time, sugar, fasting PP, and blood urea, serum creatinine, HIV, and SPS, AG, इसमें hepatitis के लिए भी कर लेना ज़्यादा ज़रूरी है, and urine for routine and microscopic, stool routine, especially for over, cyst, and occult blood, pus discharge for the culture, biopsy, radiological examination or investigation, what we require is fistulogram and transrectal ultrasonography and MRI, because we do not know that how much is the depth of the fistula, because apparently while seeing from outside there will be just one opening, there could be one or two more than one or two opening could be there, but the depth cannot be assessed by seeing the patient from outside. And when we get these investigation done, we come to know the roots of the fistula, where actually they are, it's going to the other side of the, canal, from where this is coming, how deep it is, and whether it is, opening into the one side, or it could be, there could be internal two sides and having one opening outside. So these are the things which we can be, assessed after going for the fistulogram or the ultrasonography or MRI. And with this, we will be able to, assess the actual problem. And because the patient usually asks, how long will it take to heal? So if the depth of the, canal is quite a bit, obviously it would take more time, because as I said earlier, once there is a discharge in the pus and the blood stop, people usually think that they become all right and they stop the treatment in between and stop taking precautions also. And after some period of time, it again starts, bleeding or starts having the pus discharge because there's a accumulation or is there, infection is there. So for that, we need to take care of this patient hygienically. It is very, very important. And medically also, the patient requires a proper medication. Now, another problem comes in the prolapse of the rectum, which are, rectal prolapse. They are partial or incomplete prolapse when the mucous membrane lining the anal canal protrudes through the anus only. Complete prolapse in which the whole thickness of the bowel protrudes through the anus. And some common homeopathic remedies which we have found useful are aloes, apis, calcarea, myrrh, muriatic acid, nux vomica, podophyllum, sepia, silicea, and sulfur. Now, this was the case of rectal prolapse. You could see the whole, mass has come out. And I'm reminded of a case of a rectal prolapse, which was such a bad condition was that patient. The whole rectum, anal part was out, and the patient was screaming with pain and not able to sit, lie down, and it was very difficult to touch even. So I was called upon to see the patient, and when I saw the patient was in such a bad state and the whole thing was out, so that time I had given him, nux vomica 10 3 doses to be given at the interval of half an hour. And after taking the third dose, there was a complete relief in his symptoms. Not the prolapse had gone back, but the symptoms which he was suffering, which was he was facing the acute pain, acute agony, and kind of an inflammatory condition on that has become all right. That became all right after a certain period of time. The patient became completely better, and from that day onward, he started calling me Dr. 303 because he was from, the defense services. So because I gave 3 doses, which had given him, the tremendous relief. So he started calling, homeopathy works as a 303, as fast as 303, bullet, which usually people think that homeopathy is slow in acting and giving in acute condition, it cannot give you the relief. Rectal prolapse, it occurs when rectum part of the large intestine slips down inside anus. It is caused by the weakening of the muscles, excessive straining, diarrhea, whooping cough, loss of weight, and rectal fat in ischiorectal fossa, fibrocystic disease, neurogenic deficits, maldevelopment of pelvis associated with third-degree piles, and atonicity of the sphincter mechanism, torn perineum in females, and post-surgical of fissure, fistula, or hemorrhoidectomy. These rectal prolapse can be caused because of such kind of a things also. And what are the signs and symptoms of rectal prolapse? It is a mass or large lump through anus to push back in after defecation, fecal incontinence, difficulty in bowel regurgitation, discomfort, sensation of incomplete evacuation, and tenuousness, as we have in Merck, sensation of chronic moisture and mucus drainage in perianal area, and chronic prolapsed rectal mucosa permanently extruded and ulcerated, leading to the mucous discharge and bleeding. The next problem comes is the pyelonephritis sinus, which is also called Jeep disease. Also known as Jeep disease, since it was common in Jeep drivers during the Second World War. Pyelonephritis sinus is a small hole tunnel like blind track, usually lined by the granulation that leads from an epithelial surface into the surrounding tissue, often into an abscess cavity. It is usually seen at natal cleft and generally contain hairs. It can be congenital or acquired. This disease was not very commonly known by most of the people. But whenever they have this kind of a pain or bleeding or a discharge, they would say perhaps they've got a piles or they've got a, fistula. But seeing in this particular case, the first and foremost important thing for all the homeopaths is to see that patient body is a very hairy one. It's a hairy body and having one typical small hole, which may not look to be as big, but once the problem starts and the hairs keep on accumulating inside, causing recurrent infection, because whenever you wash, whenever you do the cleaning, there are small tiny hairs which goes into the from the opening and get accumulated inside. There have been patients where they've been operated upon, there were bunches of hair coming from that site of the pyelonephritis sinus. Now here you can see in this case, this was a small hole having pyelonephritis sinus. Clinical features: acute abscess of chronic draining sinus in the sacrococcygeal area, pruritus, pain, tenderness, and induration. Risk factors for pyelonephritis sinus are obesity, sedentary occupation, long sitting, positive family history, local irritation or trauma, excessive sweating, poor personal hygiene, and excessive hair on gluteal region. The management of pyelonephritis sinus is very important. Apart from the medication, we need to as Dr. Henneman very rightly said that apart from the medication, you need to do the proper management. There could be some maintaining cause. If the management is not done, if the maintaining cause is not removed, the patient will never become completely cured. So avoid long standing or driving, depletion of hairs, frequent sitz bath, keeping the area dry, using of oil over the wound while bathing. So these are the certain general precautions which one must advise their patients to take who is suffering from pyelonephritis sinus. Now coming to rectal polyp, gastrointestinal polyps, juvenile polyps, most common, and the peak age is 2 to 5, and up to 50% have more than one polyp. Clinical presentation: painless rectal bleeding, rectal prolapse, mucopurulent stools, abdominal pain, and 1/3 with iron deficiency anemia. Now, these are the rectal polyps. Management again depends on the type of polyp. Adenomatous changes associated with higher risk. Cell polyps for the histopathology depends on number of polyps. Worse, less than 4, low risk. More than 3, re-evaluate within 1 to 3 years. This is again a case of rectal polyp and prolapse. And coming to the homeopathic management of rectal polyp, miasmatically rectal polyps come under the combination of psychosyphilitic group of diseases. Whereas psychotic polyps, benign, bleeding, and painful, with a strong family history of benign growth like tumors and polyps. And syphilitic polyps would be the painless, they are and silent to start with, but later on become severely painful with uncontrolled bleeding and can turn malignant. Now, coming to the homeopathic remedies and medicine for anorectal diseases, as I said, Aeschylus, the action of this drug is most marked on the lower bowel, producing engorged hemorrhoidal veins with characteristic backache, with absence of actual constipation, much pain, but little bleeding. Dry, aching rectum feels full of small sticks, anus raw, sore, much pain after the stool with prolapse, hemorrhoids with sharp shooting pains in the back, blind and bleeding. Worse during climacteric, large hard stool, dry stool, mucous membrane seems swollen and obstructs the passage. Irritation caused by ascarids, roundworms, and aids their expulsion. Burning in anus with chills up, down and back. Otherwise, we have got this particular sensation of Aeschylus used in almost all type of anorectal diseases. In aloes, bad effects from sedentary lifestyle, especially suitable to lymphatic and hypochondriacal patients. The rectal symptoms usually determine the choice adapted to weary people, the aged and phlegmatic cold beer drinkers. Constant breaking, bearing down in sensation, rectum, bleeding, soreness, and hot feeling relieved by cold water. As we see this in the cases of hemorrhoids, better by using cold water. And if the patient feels better using by hot water, the remedy could be arsenic or the tuberculinum. In sense of insecurity in rectum, which is a very hallmark feature of aloes, when passing flatus, uncertain whether the gas or stool will come, stool passes without effort, almost unnoticed, lumpy, watery stool, jelly-like stool with soreness in rectum after stool, a lot of mucus with pain in rectum after stool, hemorrhoids protrude like grapes. There's a, as you remember the first case where I found the patient of hemorrhoids, there was a bunch of grapes. It was treated with aloes only. Very sore and tender, better cold water application, burning in anus and rectum, constipation with heavy pressure in lower part of abdomen, diarrhea from beer. Alumina, stool is hard, dry, knotty, no desire. The patient does not get the urge to pass stool even. Rectum becomes sore, there's a dryness, inflamed, bleeding, itching and burning at anus. Even a soft stool is passed with difficulty, as we have in calcarea. Greater training, constipation of infants like collinsonia, rhinum and paraffin, and old people from inactive rectum, and in women of very sedentary habit, diarrhea on urinating, evacuation, preceded by painful urging long before stool and then straining at stool. Worse periodically and from potatoes, better from cold washing in evening and on alternate days. Hemophilis, a very good remedy where we have got a venous congestion, hemorrhage. It's usually the blood is darker in color, varicose veins and hemorrhoids, and with bruise, soreness of affected part seem to be special sphere of the remedy, acts upon the coats of the veins, causing relaxation with consequent engorgement, and passive venous hemorrhages from any part. This dark, dark or venous blood, we have hemorrhages, whereas we got a fresh bleeding and the bright bleeding, we can think of millefolium. Anus feels sore and raw, hemorrhoids bleeding profusely with soreness, dysentery, pulsation in the rectum. Millefolium, an invaluable remedy for various types of hemorrhages, blood, which is bright red, hemorrhage from bowels, bleeding, hemorrhoids, urine blood, with you have got sanicula and aurum. And peonia is the one remedy which I have also used in few cases, where most of the remedies which are indicated, if they fail, and the piles and this kind of a burning, itching pain, biting kind of a sensation, or if it's swollen, burning in anus after stool, then internal chilliness, fistula ani, diarrhea with anal burning and internal chilliness, painful ulcer, oozing offensive moisture on perineum, hemorrhoids, fissures, ulcerations of anus and perineum, purple covered with crust, atrocious pain with and after each stool, suddenness, pasty diarrhea with faintness in abdomen. Well, I think, these remedies, which we're talking about, everybody knows and we can read out in the Materia Medica also. But the only point is why I have been using it with kind of a symptom and with the experiences we have seen in the cases. The Kilkere, you have got a crawling and constriction in rectum. The stool is large and hard, whitish, watery, sour, prolapse, ani, constipation stool at first hard, then pasty, then liquid, polyp, and exostosis. And the another feature in this, even if the patient passes soft stool with the strain, feels that he has to strain even for the softer stool. Nitric acid is a remedy of par excellence when we have got it's always associated with the bleeding. Nitric acid I've never used when there is no bleeding or there is no straining or that kind of a particular pain. But little passes, rectum feels torn, bowels constipated with fissures in rectum, tearing pains during stool, hemorrhages from bowels, profuse, bright prolapses ani, after stool, irritable and exhausted. And the patient is usually, we feel, is a very stout one. Nux vomica is a remedy of choice for any and every gastrointestinal problem or anorectal problem. Constipation with frequent ineffectual urging, incomplete and unsatisfactory, feeling as if part remained unexpelled. Constriction of rectum, alternative constipation and diarrhea, frequent small evacuation, scanty stool with much urging, constant uneasiness in rectum. Phosphorus, a very weak, empty, all-gone sensation in the abdomen, very fetid stools difficult to expel, desire for stool lying on left side, great weakness after stool, discharge of blood from rectum and during stool. Nux vomica, and there's a very usual common practice we have seen in dispensaries or in other places where patient is not given much time for the history taking and all that. Whenever there is a patient of piles and chronic problem with this, there is a tendency people give sulfur in the morning and nux vomica at night to the patient, and it has shown very good results in most of the patients. This is what we have been experienced, what we have shared from the other people also. Now coming to the tuberculum verum, nasal and rectal symptoms are marked polypi, affections of children, desire to stretch, itching of anus, and consistent irritation in evening. nightly restlessness, crawling in rectum after the stool. Thuja is an antipsychotic remedy which we all know. Discharges forcibly expelled with gurgling sound, constipation with violent rectal pain, causing stool to recede. This again we have got in Salicia also, like the stool recedes back when the patient is above and that there's an urge that the patient is going to pass stool, but suddenly out of nowhere the stool gets receded. Salicia is also one of the remedy which we can use. Now these are the repertorial references where we have got the in the Kent repertory rectum hemorrhoids when the beer aggravation is nux vomica, sulfur, and milk aggravation is sepia. Riding amelioration is kali carb, thinking of their aggravation, causticum, warmth external amelioration is arsenic, muriaticum acid, and in the boric repertory, abdomen hemorrhoids, bleeding, ferrum phos, milliphonium, bleeding dark, venous blood, hemomelis, calimure, blind, ignitia, whitea, bluish, purplish. So these are the very useful pointers given in the repertory. If we see with the one-liners also, sometimes one is not able to get the complete case and all that, the only few symptoms, and especially the very specific symptoms. So one can see these repertory and take the help of these repertory and can find out the remedy and give on to the patient, which would definitely give the relief also. Now we have given a Clark has given, BBCR has given in a different section, and repertory reference Dr. Fatak has also given in the piles hemorrhoid bunch of cherries like aloes. Instead of giving grapes, bunch of grapes, you have said bunch of cherries. So it comes the same way. Diasporia cough aggravation, kali carb, causticum, menses aggravation, ammonium carb, lachesis, operation after aggravation, colinsonia occurs, crocus, urinating aggravation is kali carb. Dr. Boger has given anus and rectum, hemorrhoids, aesculus, aloes, muriatic acid, nitric acid, nux vomica, sulfur, blind, nux vomica, painful, muriatic acid, nitric acid, stephysagria, step protruding, aloes, sulfur, calcareous carb, muriatic acid. Like these are the things which we can have in the books as a reference books and the repertorial references while taking up a case. And this was a carcinoma of rectum bleeding. This was a patient of mine. You could see this, such a bad state. This is a complete bleeding here. It's been clotted blood, pain, persistent, feel many days and weeks. Now coming to the in totality, do's and don'ts in anorectal cases. First, we would come to the don'ts. Avoid constipation, diarrhea, straining for stool, delaying the urge.
Excuse me, sir.
Yeah.
We have only 5 more minutes. Will it?
Okay, sure. Spicy and deep fried food, excessive non-veg, alcohol, smoking, drugs, and unnecessary medicines, especially painkillers and obesity. And do's, of course, plenty of water intake and fiber-rich vegetarian food, regular bowel clearance without straining, limit time on commode to 2 minutes, remove library and mobile from the bathroom, sitz bath, which can be hot and cold, and food habits, which should be timely. If still suffer, then finally take homeopathy. Thank you very much. I think within time.
We have 5 minutes more.
Yeah.
That time, anyone, if anyone
Sure.
have questions, means they can ask now.
Yeah.
We have 5 minutes.
Can I take off this?
Yeah,
this slide.
please. Yeah.
Just a minute. Yeah.
Thank you. Okay.
Yes, sir. It is really a very good session, sir. You covered almost all remedies that comes into action during these conditions, because you explained everything in beautifully. Sir, what is the success rate in your treatment at the prolapse of rectum, third grade or fourth grade? Is it possible for you? Have you ever managed such a case?
We have been having few cases, but not all the cases have responded very well. But there have been 2 or 3 cases which has responded pretty well. Not all cases, certainly, because as I told you, that I mean, because of the longevity of treatment which is required, and in the meantime the patient is not getting well, so he gets disheartened and all that, then leave the treatment. But those who continue with the treatment and follow the proper instructions, as I said, the do's and don'ts and other things, then definitely it helps.
Yes, sir. Then whether you give any teachers for the easy relief of such conditions, because those conditions are a very, very advanced, really pathologically advanced cases. In
Yes,
those,
yeah,
yeah.
I do use in a few cases, not in all cases, but in few cases, yes. And I definitely, I mean, tell them the patient to go in for sitz bath kind of a thing, which is important. And these hemorrhoids, I mean, what I tell them, don't strain, even if you have this, I mean, not getting a tooth, don't strain. Because once you strain, you are, I mean, causing the problem to get aggravated. Just bear it for some more period of time. And what I usually ask them to either take sort of a spoon of ghee or makhan to put it on their food, like kind of a dal, sabji or roti. So that will give a kind of a, which works as a lubricant. So the stool, which has been very hard, so, and when they try to, I mean, strain the stool, which is the hard, and it tears the, I mean, mucosal lining. So if we, instead of straining, we give them a this thing, what you call lubricant. So the stool is passes out little easier. And I very specifically ask them not to take these kind of a seedy food, especially like anar, amrood, and this thing karela, and even the kali mirch, because kali mirch and all that, even if when you grind them, it does not become powdery. There are some small crystals remain, and when there the small crystals are there, especially in the cases of where you have got fissures, the slightest of cut is there, and the food particles, I mean, the rectum part which passes the stool, and stool has got some little bit of dryness and hard thing which tears it all the more, and which causes starts with the bleeding all over again. So these are the things which I mean, usually tell them to do.
Okay, sir. Thank you very much, sir.
Yeah.
Rambare, sir, you can say the vote of thanks now. Yes, yes, yes.
थैंक यू डॉक्टर धनेश जी एंड कॉन्ग्रेचुलेशन हमारे HMI सेक्रेटरी जनरल
Thank you, sir. Thank you
very
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 much.
thanks sir excellent session
Thank you, sir.
evidence based and photo with electoral diseases very
Thank you,
good
sir.
effect and cause effect and medicine management very very thanks sir anal fistula panel is a very good remedy pioneer of
Yeah.
pioneer effect the very good this is it is my experience and very good remedy prolapse of rectum
Yeah.
ruta very
Okay.
good and you are suggested morning sulfur and night nasunka
Yeah.
is a constipation very good selection and advice very very thanks behalf of IFPH sir
Thank
very
you.
very thanks and again presentation And Jai Homeopathic, Jai HOME. Very, very thanks, sir.
Thank you very much, sir. Thank you.
Thank you.
I'm glad.
Thank you
Good
so
night.
much to everyone. We'll see you tomorrow the same time. And now we are moving to Malayalam session. For moderating Malayalam session, I'm inviting Dr. Mariamma John. Mariamma John, doctor, please welcome.
Okay, good night, everyone. Thank you.
Good night.
Thank you, sir.